and part-time plastic surgeon here, Jonathan Staiano, here to answer your questions. If you've got any questions about plastic surgery related queries, I am your man and you're in the right place. Please feel free to post away or just listen, really, because I've got some questions that have been preordained. Jackie's here, and UC Biodoll is in the house. The best is here. Yes, UC Biodoll and Jackie's here, so we can begin. Nice to see you both. So Jane Thorne is also in the house, who I'm going to wave at. Thank you very much. So I got some questions to get the ball rolling, which is just as well, because God knows no one else has. But as ever, I am prepared. So have no fear. Well, let's get this question out of the way before anyone else comes, because it's a bit of an awkward one for me, this. This says, do you use Be-Light breast implants? Could polyurethane be a good alternative, as I want them to be as light as possible? So I always say, and it's true, that I'm not linked to any breast implant manufacturer, so I can use any implant as long as the hospital can get it, or as long as I can get it and bring it to the hospital. I can use any make or manufacturer you want. So if anyone's got a view about a certain make of implant, then they can have that, no problem at all. And obviously Be-Light is a make of implant, and actually Be-Light implants are made by Polytech, which are the same company that make polyurethane implants, which I use quite a lot of. So I can use Be-Light implants. Now, the problem with plastic surgery and the problem with plastic surgeons, and maybe all surgeons, is we do still have a lot of our practice based on experience, because rather than maybe cold hard facts and evidence, because when you look at it and when you look at it, at the end of the day, no one knows anything. There are no facts about what is the best this and what is the best that. You know, people say, oh, there's a paper that suggests this implant's better than that implant. Well, that paper was probably looking at 100 people or 50 people or 200 people or whatever, but still, it's not looking at every single person in the world ever. No one is out there collecting all the data for everybody. God, I don't know how I got onto that. I got off piece there a bit. Sorry, stick to the script, man. Stick to the script. So the point of the matter is, we do still base a lot of our practice on experience. And I used Be-Light implants, which are light implants, on a patient, and they flipped. They flipped front to back. So they were round implants, and they flipped. So teardrop implants could obviously rotate. For round implants to flip is very rare. It's a very rare complication. It's only happened once before, and that's what I thought, crikey, that's weird. So what happened was one of them flipped, then another one flipped, and then I flipped them back and they flipped again. So the sample size of one, I totally get it. So it may not be anything to do with the Be-Light implants, but it has put me off. So I don't really use Be-Light implants, to be honest with you. But, you know, as I say, I don't think that necessarily means that's sort of not evidence. That I don't think that's a known thing that I'm aware of. So it's just me personally. So, yeah. Could polyurethane be a good alternative, as I want them to be light as possible? Now, having said that, they are bringing out, or they were bringing out, a polyurethane Be-Light implant. So I think that's much less likely to flip, because the polyurethane foam coating is much less likely to flip. But I don't think polyurethane implants are lighter than normal silicone implants. So if you're asking for Be-Light implants because you want it to be lighter, I don't think polyurethane will be necessarily a better alternative than a standard textured or smooth silicone implant. So I think you either go Be-Light or you go, normal. And I think the concept of Be-Light was a good one. And I said this to them, and I've spoken about this before, that I think the concept of a light implant is a good one. It's just that I had a problem with one, or two, should I say. So I don't use them. But yeah, I don't think polyurethane would be necessarily an alternative in terms of the lightness of it. I mean, obviously it is an alternative, but it's not. It's the same weight, I think, as a silicone implant. I don't think polyurethane are lighter than silicone implants. Sophia Kawuya Kawuya Williams. That is a great name. Kawuya Williams. Kawuya Williams. That's like University Challenge. Kawuya Williams, Oxford. Anyway, Sophia says, hi, I'm wondering whether nipple inversion could be corrected during breast enhancement. Wow, Sophia, how weird is that? I think the untrained eye, Sophia, would think that you are a ringer, because that is the last operation I just did a few short hours ago, was breast enhancement, and I corrected a nipple inversion at the same time. So yes, I've just done it, and it is possible, and yes, absolutely fine. The thing, people sometimes get a bit or you don't want to be confused with, like, for instance, a nipple breast lift or a breast reduction. I'd be a bit wary about doing things to the nipple at the time of a breast lift or a breast reduction, because you move the nipple with those operations and you worry about the blood supply to it. But certainly in breast enhancement, no worries, Sophia, no worries at all, and no worries about doing that at the time of a the time of the breast enhancement. And the other very exciting thing is, Sophia, I've got reason to believe you're on YouTube by that little red thing. So that is exciting in itself. So thank you for commenting on YouTube, Sophia, and I hope that's been helpful. But yeah, absolutely fine to have an inverted nipple at the time of a breast enhancement. I think there was a question on Instagram which I might have missed, so I'm going to scroll. Here we go. UC Bio Doll. Do you do tummy tuck and lipo at the same time, and do you do finance? Yes and yes, UC. So it's very common to do tummy tuck and lipo, particularly lipo to the hips, to sort of contour the whole abdomen. So often when you do a tummy tuck, well, not often, always, it contours the central abdomen, and it doesn't contour the hips, the flanks, the side bits. So you can combine it with liposuction to those bits. So that's a very common combination. Do you do finance? What we found, it's an interesting question, you see, because I used to work at two private hospitals, Priory and Parkway, which are big companies, BMI and Spire. And they offered finance. They offered 0% finance. So I never did, because, you know, it costs to do 0% finance. And I thought, what's the point? Because the hospitals do it. And then we looked at doing normal finance, and we thought, actually, you know what? You go on the high street and you get better, better deals than I could do. But anyway, bottom line is we relied on the hospitals. Now, a lot of the surgery I'm doing is not, those hospitals have got really limited availability. So most of the surgery I'm doing is up in Liverpool with a small private hospital which doesn't do finance. So we don't do finance for there. But if you weren't time sensitive and you wanted to have surgery in one of the hospitals around here, they are starting pretty slowly, I've got to be honest, to give us some lists. So, if you had it done at a BMI or a Spire hospital, then yes, they do offer finance, or we do offer finance sort of through them. So yeah, but tummy tuck and lipo is a good one. Definitely. Let's get some waves going in. Oh, Sophia! Oh my God, Sophia is getting the comments in YouTube. Yes, awesome. It is an enlargement. Yeah, an enlargement. So at the time of an enlargement, it's absolutely fine, Sophia, to do a nipple inversion correction. And as I said, just done one this afternoon. And you see, you're very welcome. What we got here, we've got a question that says something like this: under the muscle or over the muscle placement, which one gives the most natural look? So this is one of those ones where I think it's very easy to give a soundbite answer, and I think I'll be honest, I've been criticised on YouTube for, shall we say, waffling / droning on. I'm going to take the criticisms on board, but the problem is, do you know what? It's not black and white, a lot of this stuff, and you can't be too, you can't. I can't just say yes or no to that. I can't answer that question yes or no. I can't, hand on heart, I cannot say under the muscle or over the muscle one gives a more natural result. I cannot say that. And the reason I cannot say that is because the vast majority of my patients want a natural result. And I sometimes put them under and I sometimes put them over. So if one of them gave a more natural result, I would do it more often. So it depends on the person, it depends on the implant, it depends on the type of the implant. Basically, the difference between under or over the muscle is when you put them on top of the muscle, there's more of a risk of it rippling, seeing visible rippling. So if you're very slim, if you haven't got much subcutaneous fat over your chest, and then you can increase your risk of rippling. Certain types of implants, like for instance the smooth silicone implants, ripple more. So certain types will ripple more. So these are putting your risk of rippling to be higher. Therefore, you might say, well, that's not very natural having rippling, is it? So I'm going to put them underneath the muscle because that's going to give me a more natural result because it's going to hide the implant in the upper pole. True. But the muscle they can sit high, they can sit wide, and you can get animation deformities, which means when you move your arm, the breast moves. So that's not natural, is it? If you get an animation deformity, or if they're sitting high, or if they're sitting wide, doesn't look natural. So that would be a reason to say, well, they're more natural if you put them on top of the muscle. So the answer to the question is, it depends on what's right for you. You have to balance. There are things that can make it look more natural for them being on top, and there's things that can make them look more natural from being underneath, and vice versa. And you have to balance the risks versus the benefits. Not sure if I've understood, if I've explained that very well, but basically what I'm saying is you just can't give a straight answer. Much as I think people would like me to say, yep, this is the best way to do it, that's more natural. It depends on the person. It depends on your soft tissue cover. It depends on the size and the type of implant you're having. Fact. What it is. UC Biodol, do you do fat transfer .bbl? Yes, I do fat transfer. BBL, no. BBL is Brazilian butt lift. So I do fat transfer. So I do suck fat out of parts of the body and inject it into other parts of the body. And I love doing fat transfer. It's a fantastic technique. BBL, which is a Brazilian butt lift, where people injecting fat into the buttocks, is a little bit frowned upon at the moment. It has been for some time because there's been quite a lot of problems worldwide with it. So it has been, I think, I should know, shouldn't I? Certainly the last BARPS meeting, which must have been over a year ago, where they said that we weren't supposed to do it anymore. We didn't have a BARPS meeting just gone. So, because it was all COVID and all that. Although I think they had a virtual one, but I think I missed it. But anyway, I think we're not supposed to be doing Brazilian butt lifts, but I never did anyway. Because the risks are high. So I do fat transfer, yes, but not into the buttocks. Into the buttocks is high volume fat transfer, which is got increased risks and not what I do it. So I would do it into the breast. I've done it into the leg, for instance, someone with a congenital a weakness in the muscles of the leg. So one leg was smaller than the other. So you can do it into areas where there's fat deficiency, basically. But as I always say to people, it's always subtle, the results. So we have to have a proper conversation about it to see whether it'd be a good thing to do or not. But yeah, sorry, I don't. Not many people I say that. I don't think that many people in the UK do it or did it before it was. I think there were a few. But be careful with Brazilian butt lift because it has got a bit of a complication associated with it. So you've got to be aware of the risks, and as with anything, weigh up the risks versus benefits, as with any surgery, really. Celie is in the house. Long time no see, Celie. How you doing? Hi, random, I guess, but one of my members is due to have WLS. Oh, crikey. WLS in 3 weeks. What the heck is WLS? Oh, weight loss surgery. Maybe weight loss surgery in 3 weeks. But after having COVID 2 months ago, feels she could have long COVID. Does long COVID show in a test? And can you have any surgery if you have long COVID? The symptoms are the same as someone with obesity, i.e. breathing issues and tiredness. How does this work in any surgical setting? Wow. God. Celie, honest answer, I don't know. I don't think there is a test for long COVID. I don't know if obviously if you're going to have surgery, you would have you would have to have a negative test. So if you were testing positive for COVID, your surgery would be cancelled. But I don't know if this long COVID, you no longer test positive for COVID. I don't know because it was 2 months ago. So that's number one. So I don't think there's a test, Celie. So can you have surgery if you have long COVID? So I don't. It's a tricky one. It's a tricky one because I'm not sure if there's a set sort of thing that says someone's got long COVID. So as you say, they're just saying that they're tired, which are the same problems with obesity. The issue, I guess, will be, and the thing is, when anyone's got a problem and they're thinking of having surgery, which is elective surgery, so planned surgery as opposed to urgent/emergency surgery. So if you've got a cancer or if you've got a broken arm or something, you have to have the surgery. But this is elective surgery, so it's planned surgery. So we want to do it when you're in the optimized state, basically. We want to do it when you're at your best. So if you're not at the best, whether you got long COVID or whether you've got an exacerbation of your symptoms that you normally get due to your weight, then I would say you should postpone surgery until you're better. Now, if you feel that you're not going to get better or you're as good as you're going to get, then you've got to weigh up the pros and cons of doing surgery now. So I guess I would just sort of fall back to that sort of algorithm that I would with anyone. It's like anyone with a sort of chronic condition. If there's something you can do to optimize that condition, then you should do that before having surgery. If it's optimum at the moment, then you've got to weigh up the pros and cons of doing surgery now. Tricky one. Oh, weight loss surgery. Oh, it was weight loss surgery. Okay, here we go. Simon Monkhouse said the same. Good. Consistent. He didn't know either. Oh, right. Oh, okay. Consistently not knowing. Right. Okay. Awesome. Still, there's a lot of unknowns out there in the world, It's the known unknowns, isn't it? It's a known unknown, that. Right. Louise. Oh, this is an easy one, Louise. Is this an easier one? I've got cysts in my breasts. Is it possible to still have implants? This is an easy one. Yes, Louise. Now, as with any breast lumps, you should get them investigated. The fact that you're saying you've got cysts there, presumably you have had them investigated. So if you've had them investigated and they're fine with them and they've said, look, they're cysts and don't worry about it, absolutely no problem having breast implants. And if you were to go on and get more cysts and need any more investigations, absolutely no problem with having that. I say absolutely no problem. If they were doing stuff like putting needles in to drain them and stuff, they'd probably be a bit more wary if you had implants in. So they might need to do it under ultrasound guidance. But in principle, absolutely fine, Louise, to have implants if you have cysts in your breast. No problem at all. As I say, get the cysts checked out first, which it sounds like you have. So Ruth is here, and what Ruth is saying is, hi, I've had breast implants for around 3 years now, and my left side has become more firm than the other. Is this normal? Oh, normal. This can happen, Ruth. And I guess the most common reason for this happening would be something called capsular contracture, which is scar tissue forming around the implant. And a lot of people say the implants go hard. The implants don't really go hard, to be pedantic. It's actually the scar tissue that forms around the implant that goes hard, that tightens around the implant and can make it feel hard. And that's one of the big sort of longer term complications with breast implants, and one of the big reasons that people might need to have them changed. So it might be that. I'm not saying it is that, but it might be that. I've got to be honest with you, Ruth, 3 years is quite soon. So to be getting it 3 years is quite soon. You're quite unlucky to be getting it that quickly. The normal advice I give people who do start to have these problems is, first of all, if you're getting some changes in your breast, if it's going hard or if you're worried, it's always best to get it checked out. Are you my patient? I don't think you are. But if you are, come and see me. If you're not, go and see your surgeon, because it's or your GP or whatever, because you want to get things checked out to check we're not missing anything, because obviously you don't want to mess about with breasts. If there's any sort of changes, we've got to be sure there's nothing sinister going on. But as I say, if it is just the implant going firmer, it sounds like the most likely diagnosis might be capsular contracture. Tends to be a progressive condition, so it probably will get worse, but it might take many years to get worse. The treatment of capsular contracture is to remove the capsule and the implant and to put a new one in again. But that's the problem with it. The capsule is scar tissue around the implant, and if you remove the implant and the capsule, that creates quite a lot of scar tissue. So another capsule comes quicker second time round. So I always say to people, leave it as long as you can before having the capsule removed and the implants changed. So if it's only a little bit firm, yes, get it checked out. But if it's not too bad, I'd probably leave it as long as you can, Ruth, because you don't want to keep on having changing implants every few years, do you? So yeah, that's what it seems like. Seeley, fab, thank you very much. Appreciate your input. Seeley, very much appreciate your input. Lol proves a point, though, doesn't it? We just don't know. We just don't know, Seeley. I think people think that we know more than we do in medicine. They think we've got all the answers, but Louise, thanks. I've had them looked at a few weeks ago. Well done. So that's the main thing, Louise. As long as you've had them looked at, then I would be I would be fine to go ahead and have breast implants, no problems. Sophia on YouTube, nice one, Sophia. You're keeping up the numbers on YouTube. Well done, you. Give yourself a gold star. How long is advised to rest after breast enhancement? Also, what is deemed a no-no during recovery, i.e. driving, lifting, etc.? Nice question, Sophia. You're doing well tonight, if you don't mind me saying. Not that everyone else isn't, because we all are in equal opportunities, but Sophia's good. So how long to rest after breast enhancement? Broadly speaking, Sophia, and it is broadly speaking because everyone's different, we're all individual, but broadly speaking, I normally say the first week you don't feel like doing much. It's a bit tight, a bit swollen, feels weird. You have to let everything settle. After the first week, you'll be feeling better. The dressings comes off. You'll be feeling a little bit better. You'll be doing stuff at home, pottering around, doing like computer, emails, stuff like that. But still taking it easy. Driving, I normally say 2 weeks to be safe. You might be all right after 1 week. It's as I say, variable. Sometimes people are okay after a week. You might better check with your car insurance. Sometimes they say it's got to be a certain amount of time. But I'd say 2 weeks is safe, but often people are okay after 1 week. It depends a little bit on. Sometimes you can put the implants on top or behind the muscle. If you put them underneath the muscle, it's a little bit more uncomfortable than on top, and little things like that. So driving, a couple of weeks. Lifting, nothing heavy for about 6 weeks. Always difficult when people have got small children, because obviously you're going to say, oh, we've got small children, so you might have to do some lifting and things like that. No, I'll tell you what the no after surgery is, Sophia. Smoking. No. Particularly for the first 2 weeks after the surgery, you want to get that healed. What else is a no after surgery? Just upper body stuff, gym and things like that. First month, I would say, upper body gym stuff. Lower body gym stuff after 2 weeks, like the exercise bike and things. Not the running, but the exercise bike. So upper body exercise, smoking. What else? That it. Positive thinking. So negative thinking's a no, Sophia. That covers it, I'd say. Anyone else got anyone to chip in? Ruth, thank you. Kimberly is here. Hi, Kimberly's here. Look at that. Thank you. I've had my breast earlier, and the nurses were fantastic. Kimberly, did you see what the first question was from Sophia? Sophia was wondering whether nipple inversion can be corrected during breast enhancement. Feeling crap. Oh, okay. Kimberly, I've got to be honest with you. You got to take it easy, and you should be putting your feet up, watching Antiques Road Trip, not being on Facebook. Come on, have a word with yourself. Take it easy. And I'm not going to put feeling crap up there. Oh, look, here we go. Seeley's got some advice. Booze. No, don't. Or is that a no? I wouldn't say it's necessarily no, but don't listen to Seeley. Kimberly. YH. What does that mean? YH. Anyway, it's either a typo or it's some cool abbreviation that I don't know, like WLS. I meant no booze. She meant no booze. So good. Right. Not yet. Well, not yet. Anyway, right. Stick to the plan, man. Sophia's back on. I have kids at home. So that is 5 kids at home. Yes, that is a problem. So I always say to people, no heavy lifting for 6 weeks. And they say, I've got 5 kids at home. So obviously, especially if you've got little children, you have to sort of, you have to pick them up if they fall over, sort of thing. So, it's just within reason. So I think you just have to pick them up. So you can't, and it's quite obvious, well, not obviously, but, often people who have small children have breast enhancement because they lose volume from having had the children. So it's sort of quite a common group of people to have breast enlargement. So something we can do, Sophia, if it's helpful to you, is put you in touch with someone who's had it done. Sometimes we do that. Look at this. Colombian Glow 3 means yeah. YH means yeah. Does it? Is that a thing? YH means yeah. I'm not with it, am I? WLS, weight loss surgery. YH, yeah. I got to write. I should be keeping a glossary of terms. How's YH? Yeah. I mean, who invented that? How do you start these things? YH, yeah. I mean, yeah is only YE YH. Anyway, okay, yeah, okay. I'll bow to your knowledge. There you go. I've learned something there. I didn't know that. YH was yeah. So oh god, everything's going on. What's going on here? Ali Nicholas, how are you? How long on average will it be before you change your resources again? Don't you talk like that, Ali. I'm not having that. How can I delete that comment? Come on, let's have positivity from you. How long after you change your existing implants? The answer to that, Ali, is never. You never. I wouldn't ever. Well, never. But I could think of a quote around this. I'll have to work on it. So I'll work on it offline. But basically, what I'm trying to say is, never plan to change your implants, but you might always expect you might need to change your implants. Yeah, is that quote working? A bit like sort of plan for the worst, hope for the best. Yeah, bit like that. Yeah, plan to have them changed, but hope to never have them changed. All right, is that clear? So basically, what I'm saying is that a lot of people say they've got to be changed every 10 years. They haven't got to be changed every 10 years. The implants themselves, most of them, all the ones we use, have got a lifetime warranty. The implants themselves are built to last forever. The problem is the usual problem is capsular contracture. I guess the two problems are going to be a capsular contracture and rupture. I mean, there's ALCL, which is that cancer, but it's so rare that. But you know, the two main problems are going to be rupture and capsular contracture. And these days, rupture's not very common. The implants are much a more stable gel, so they don't leak if the shell does fail. So often, well, not often, but the shell might fail. You might not know about it, and it doesn't really matter because they keep their form. So the main problem is going to be capsular contracture, which is scar tissue forming around the implant, which arguably is not. It's not a problem with the implant. I mean, it is the implant causing the problem because it's your body's reaction to the implant. But actually, when you do a capsulectomy and change the implants are usually fine. It's not the implant that's the problem. Is the capsular contracture. It's the scar tissue forming around it. And I normally say to people that takes about 5 or 10 years for that to happen. It's less in the polyurethane implants, but still, it's more in the smooth implants, and then the textured silicone ones are in the middle. But anyway, 5 or 10 years, they can start to go hard. And you might want to have it changed. So who was it? Was it Ruth? Someone was saying earlier that they've got a 3 years post and they've got a bit of a firmness. So 3 years is quite early, but so I'll be connected to leave it. So the bottom line, Ali, is if you've got no problems, don't have anything done. Now, you can always come back and see me and we can, talk about stuff. And I always say to people, come back every year. I offer that to everybody. You don't have to come back every year, but there's always an open appointment if you want to chat about it. But in terms of having surgery, I would say if you haven't got any problems, I wouldn't have any surgery. If you've got problems, then maybe you will need surgery. So don't go looking for surgery. Colombian glow is, oh God, I've missed out. Oh my God, what's this? UC lol yup. Oh my God, Doc. Well, hello, Miss Karina Beans in. Nice to see you this evening. TT equals tummy tuck. I know that. I know TT. I'm not that bad. God, I didn't know. I mean, I'm a plastic surgeon, UC Biodol. Yeah, fully qualified. I got certificates and all. I haven't got them with me, but honestly, back at the clinic, I've got all the certificates and everything. So I know TT. I didn't know WLS, admittedly, but YH, come on. No one knows that. Ali's very well. Nice to hear, and thanks for chipping in, Ali. It's nice to see you. Colombian Glow's laughing. Pauline Magpie. I know you're talking breasts, but do you perform brachioplasty? I'm talking anything, Pauline. I will, you name it, I'll talk about it, girlfriend. Yes, I do. And for those at home who don't know what brachioplasty is basically arm reduction. So I basically, Pauline, do breast and body. So I do breast, whatever, bigger, smaller lifts, etc. And then body is mainly tummy tucks, but also arm lifts. And thigh lifts and liposuction. So brachioplasty, scar down the arm, and do it. I do, Pauline, I do. Dr. Katie's here. What's going on? Oh God, I'm losing. I'm getting to the level of social media influencer that I need an assistant, I think, with this to keep track, because I can't be expected to keep track of this. The chat's kicking off all over the place. So I'm on Instagram here and I'm on Facebook. So let's see what's going on Instagram. I know you're totally overdone that one. Now we have to think wisely with implants. Yes, we do. We'll stick to hope then you did give me the best boobs. Did you hear that, Facebook? Right. Thank you for that vote of confidence, Ali. And yes, but Ali, you know you can come back to clinic. You know, I hope you know that. Always lovely to see you. But you're always welcome. But I would stick with them actually. Check you out. Oh God, Elena's in the house. Pauline, please do with the lengthy scar. Crescent. Oh God, what's happening? What are you on about? Please do, Dr. Pauline. You talking about arm reduction? Yeah, brachioplasty. Yeah. So arm reduction does give a lengthy scar, Pauline. It does give us crescent. I'm not sure what crescent. So the way I do it is I do a scar going down the arm and then up into your armpit. So it's like an L. It's not a crescent. It's an L. And it is long. It goes down to your elbow. And like anything, Pauline, everybody wants a short scar. Everyone's kind of a short scar. I can have no scar. I have a no scar. And, yeah, you can have a short scar. Of course. Yeah, you can have no scar. Yeah, you can do some, topical thing. But if you're doing, so yeah, you can have a scar in the armpit. Yeah, just a tiny little scar in the armpit. The less scarring, the less skin's removed, the less of an arm lift. So personal view, I wouldn't do it with just a scar in the armpit, because what's that going to do? Pull a bit in a up direction. That isn't going to take much skin out. Scar in the armpit, risk of wound healing, etc., etc. You've got risks. Yes, it's a hidden scar, but it's not going to give you a great lift. And to the extent I would say, look, it's not even worth doing. If it's worth doing, I'm same on the thigh, to be honest with you. And actually, the thigh lift in the groin is more acceptable than an arm lift with this arm and axillary excision. So it's the thigh and arm. I feel the same way. If I'm going to do it, if I feel it needs doing, the best way to do it is a big long scar down there. And a lot of people say, I don't want that. And I'm like, I totally understand. I don't want to give that to you, because if you don't want a scar, then you're going to be, so don't have it. And it's like that, binary, really. If you don't want that big long scar down to your elbow, by and large, I would probably say don't do it, or at least I wouldn't do it, because it's loose skin. And if you do it, people say, I want this skin removed. You always pinch like that, don't you? You pinch like that. Oh, Sophia, what? Sophia's got the thing. You pinch like that. You don't say, I've got loose skin, I want that. It's very hard to tighten the skin that way. Am I demonstrating it with my arm, with my jacket? It's like that, isn't it? Yeah, so I think it's better to do a big long scar or no scar at all, i.e. don't have it done. Stargazer. Should I? Anyway, I'll do Stargazer, then I will see what's going on the Facebook. Any advice for a BA incision, which is lumpy and painful 1 year post-scar revision? What could possibly be the cause so long after? Stargazer, hypertrophic scarring could be the cause. So lumpy, it's not common for a BA, breast augmentation. I know that abbreviation. I'm assuming it's breast augmentation. It's not common, but it is. It can happen, and it can happen with any scar, and it could be a hypertrophic scar. So what causes it? Well, it might be due to delayed wound healing. If your wound takes more than 3 weeks to heal, you've got a very much higher risk of hypertrophic scarring, but some people can just get hypertrophic scarring. So what I would say to you, Stargazer, is talk to your surgeon, because yes, there are things that can be done. And so things like, well, first of all, massage. Keep it simple, massage and moisturize. But it's a year now, I think you said. Yeah, a year. So then you can move on to other stuff like silicone. And if it's I'm assuming it's an inframammary incision, silicone strips can help, because your bra strap can hold them on. And actually the pressure of a wire of a bra can help with them. So silicone strips can be helpful. You've got to wear them 23 hours a day. Just take them off to wash. And finally, steroid injection, I would imagine, would be the next thing, which is, if it is a hypertrophic scar, that is. So there are things that can be done if you haven't tried those things already, but it's saying you've had scar revision. So presumably that was done by a surgeon who would probably know these things, who would hopefully be looking after you and talking about these things. But these are the sort of things I'd be looking at silicone strips and steroid injections. Sorry, Facebook, I hope you haven't all gone home. No booze, not yet. Sophia's got 5 kids at home. Khan, late to the party. Khan, it is kicking off big style. Khan, you knew me before I was famous. Look at me now. Honestly, I've got double figures. Should that Stargazer, should that help the pain though? Pain often I don't know, Stargazer. Often hypertrophic scars aren't usually painful. They can be itchy. Then the steroid injection can really help with the itch. Pain, no, not so much, I don't think. I mean, the steroid will dampen down the inflammation. It might help with the pain, but to have a painful scar a year post-op, I don't know. You probably have to see your surgeon. Is there a point where it's painful? Is there like a little nerve, a little neuroma or something? I'm just trying to think, it's unusual to have a painful scar a year post-op. So you probably have to see someone to see if there's something specific that is causing that pain. And the steroid and the silicone might not help the pain unless, as I say, it's itch, which can be uncomfortable. And you are welcome. Thank you for asking the question. Kimberly, get help. What are you on about? No booze thing, get help. Tracy is the first one tonight. So Tracy, there'll be a check in the post to you for the winner of the competition for the hashtag AskJJ. So we will be sending out a hairy toffee to everybody the first person who uses the hashtag AskJJ. So congratulations, Tracy Bell. You have won the hairy toffee. So hashtag AskJJ, first of the night. Come on, guys. You can do better. You can do better. You know it. You know we're trying to get that hashtag trending. All these people asking questions without using the appropriate hashtags, honestly. So thank you, Tracy, for the hashtag. Question is, I've had my mummy makeover. Whoop, whoop. How long should I walk bent over for as I can't straighten up? I'm 11 days post-op. Very common question, Tracy, this. People say, when can I walk straight after my tummy tuck? So it's the tummy tuck that's doing it. And you know what, Tracy? I normally say to people, when you feel up to it, don't push it. Just go with it. The whole point of doing the tummy tuck is to make it tight. That's the whole point. So you want it to be tight, and you have to make it tight, and it will give over time. So don't push it. Don't try and stretch it or anything like that. But it can take a while. And 11 days isn't much, Tracy. Stick with your surgeon. Always talk to your surgeon and work with them. But I think just whatever. Just you'll find the first couple of I think you'll probably in the next few days, so as I said, after the first couple of weeks, I think you'll probably find it maybe starts to get a bit easier. You're probably wearing a binder, I'm guessing, but just go with it. And I know what you're going to say. We've got a bad back and all that, and no one really likes all that walking over stoop. You get bad back and bad posture and everything. But just go with it, Tracy. It'll come. It'll come. But there's no set answer. Some people at 11 days are walking, not bad, and some people are really bent over. So it's just people heal differently and the skin will give over time. Kimberly Owen, me. You. Seeley, oh my God, I just remembered. Did you see The Real Housewives of Dallas? The dude that is plastic surgeon and your double. I'm going to find them. I didn't, Seeley. No, I didn't. I try and avoid those sorts of programs. My double. What a lucky guy. Really? There's another one. Really? Right. Okay. Excellent. There you go. Another social media influence out there, like myself. Well, we'll have to hook. I'll have to hook up with the plastic surgeon in the Housewives of Dallas and say, hi, I'm JJ. I do the hashtag AskJJ Facebook Live every Tuesday at 7:00. You probably heard of me. Sophia, youngest 6, so should be okay. Yeah, 6 is pretty good, Sophia, because they'll be moving about and stuff like that. So hopefully not too much on the old lifting. Mark Duber. Right, we'll have to check him out. Mark Duber, check him out. With children. Tracy's laughing. I don't know, Tracy, I don't know what's going on. I really don't. Sophia, back. Yes, Sophia, love it. You mentioned about being put in touch with someone who's had a similar surgery. That'd be very useful. Sophia, yeah, I did. It's perhaps I should have qualified that. It's for people who come to the clinic. So when people come to the clinic, I don't know if you're in Edgbaston, but if you want to come to the clinic and see me or Kurum or see one of us, then we offer what's called a buddy scheme where we put someone in touch with someone who's had it done. But having said that, there's loads of people here tonight. They're all over the place, aren't they? Look at them all. they've all got experience. But yes, if you do come to the clinic, Sophia, and see one of us, we will put you in touch with someone who's had it done. If you want, we don't have to, but a lot of people find that helpful to talk to someone who's been through it. But look at it. See, look at this. I keep waking up about 7 times in the night for a wee. Is this because of the swelling going? Yes, and it might be it's sort of irritation of your bladder and things from the tummy tuck. So yeah, but what a nightmare. Cool, yeah. What's going on here? I am Kat. Hi JJ. Hope you're well. Do you remember when I had the mole removed on my back last year? It's healing so well. The scar is only slightly pink now and much smaller. Do you know what? I struggle. I'll be honest with you. I struggle to often to know who's who. And so, you know, because when their name, like your name on Instagram, it's not obvious. It's not obvious. I can't really see a picture, but I hope all was going well. Mole formation back last year. So, and often people, like someone last week said, I'll see you on Friday. I'll see you on, and I'm like, who? Because the name's often like, you know, Stargazer 420, you know, or actually Facebook's not so bad because they're all proper names, but you know, on Instagram particularly. But anyway, I am glad the scar's healing up well. I am a cat. I am Imia cat. Good to see you here tonight. Glad it's healing well. Have you been back to clinic? If not, swing by. Let's have a look, see how it's going. But you don't have to. But if it's going well, that's good. Good to see you. Thanks for commenting. Thanks for the positivity. That's what we need in this world, isn't it? That's what the world needs. Positivity. Stargazer 420. Can you please explain what inferior capsule flap to redefine IMF left, IMF lower plus? Seeing this on my surgical note, and I have an iota what it means. Wow, we're getting technical now here, people. Are you ready for this, people? Are you ready? Huh? We're getting technical now. All right, this is a technical section. I need a technical section. Right, okay. So, inferior capsule flap to redefine IMF, left IMF lower plus. Okay, so basically the capsule is the scar tissue that forms around a breast implant. Every single person with breast implants has got a capsule. Everyone's got a capsule around their implant. It's a real problem when the IMF is your inframammary fold, the fold where the wire of your bra sits, and it's a real problem if your inframammary folds aren't level. It's difficult. Basically, it's a problem. So, oh, Mia, of course I know you, Mia, of course I do. Sorry, of course I know you, Mia, but I didn't know you were Mia. So sorry about the capsules. So if the inframammary folds aren't level, it can be a real problem. The easiest thing to do if your inframammary fold is not level is to lower the higher one. Yeah, so that's the easiest thing to do, to lower it, to balance inframammary folds. But what you've got to do is you've got to center the inframammary fold. You've got to center the implant on the nipple. So it might not be appropriate to lower the higher one if that's going to make the implant sit too low, because if the implant sits too low and the nipple can look too high and it can look weird. So if your inframammary folds aren't level, then obviously the other option is to higher it. So if the inframammary folds, if the implant's descended, so-called double bubble or whatever, if the implant's descended and has descended below your inframammary fold and your fold is too low and that needs to be then raised, that's more difficult. It is quite difficult to recreate an inframammary fold higher than where it was, because what you've got to do is you've got to close down the space where it was, because you don't want the implant falling back into that space where the implant was. So what you can do is you can use the capsule. So when you do the surgery, you can open it up and you can use the capsule, so you can raise a bit of capsule, so you can cut a bit of capsule, especially if the implants have been in a bit of time. That's got a bit of substance to it, a bit of, you know, because you really want to get some stitches in there with a bit of oomph, and you don't want to put some stitches in the fat, because the fat just pulls through. So you have to put the stitches through something with a bit of substance, and so to say, if the implants have been in for a little time, you might have some well-formed capsules, so you can raise a flap of the capsule and use that as a hammock, use that to redefine that fold, to redefine that inframammary fold. So that's what they're talking about. They're talking about your pocket is too big, so they need to somehow higher it. So they'll cut out a bit of capsule in the lower part in the inferior. So the inferior is the lower part of the capsule, and raise it as a flap. So literally a flap is just, so the capsule's stuck like that. They'll cut behind it so it's flapping about, and then they'll stitch it down to recreate that inframammary fold. That's made it clear. I won't worry about it. Anyway, they're just trying to recreate your inframammary fold. But what I would say, it's a difficult thing to do. Recreating inframammary folds is difficult, and keeping them there. And you often get, well, in my hands anyway, you often get little dents where those stitches are. They're dissolvable sutures, so those dents go. But it's a hard thing to do, to recreate an inframammary fold. And it's obviously something you do when you're doing breast reconstruction. So when someone's had a cancer and you're recreating a breast from nothing when they've had a mastectomy, so it's a major part of that surgery. So it's a tricky part. It's a tricky op you've had there, Stargazer. So I hope it's gone well, but that's what it is. So that's okay, JJ. It's Mia. Of course I know who you are, Mia. Goodness me. What did you say? You had three most remote ages ago. Oh, you had one from the yes. On my face, neck, before that too, and one on my scalp at the same time as the back. They're all healing perfectly, so I want to give some feedback. Mia, I know exactly who you are, and yes, of course I remember you. And it's just I didn't realize your handle. I didn't realize your handle. But lovely to hear from you, Mia, and thank you for that. And as you know, I think you moved away, haven't you? But anyway, always welcome at the clinic if you are around. Waving at some people here. Good to see you, Mia. That was nice. Oh, Mrs. Rissoda has sent a request to be in a live video. I'm going to assume that's a mistake, because I think lots of people do that. Mrs. Rissoda, if you do want to be in a live video with me, I will accept you if you want, and then we'll be split screen, and you'll be in, and we can talk if you've got a question. Implant was setting far too high afterwards, needed revision. Is that why? Stargazer, no. I thought you would use an inferior capsular flap for an implant sitting too low. So the implant sitting low, you would redefine the inframammary fold with a capsule of the a flap from the inferior capsule. So I was assuming your implant was sitting too high. If your implant was sitting too high, then I would just do an inferior capsulotomy, which is making a hole in the capsule and then just lowering it. As I say, that's easier to fix, and it's often when they're under the muscle, so you need to make sure you release the muscle immediately. So that'd be a slightly different thing, but unless you're saying it was far too high after the revision. Anyway, I'm okay for this occasion. Thank you. Okay, you're lucky, Mrs. Rissoda, because if I'd said accept live, I think I would have appeared in your living room. So you are very lucky. Dodged a bullet there. What's this +1? Go live in a room. Oh God. Right. No, I won't press it there. What we got? I will be on 21st. Oh, Sophia. Well, then we'll do your buddy then. 21st. When's that? Not long now. 10 days. Well, hey, looking forward to seeing you. I've got an appointment with you. Awesome. Seeley, I know, right. I used to own a pub, and people become Seeley's off on one, guys. What's Seeley off on? I know, right. I used to own a pub, and people become drinks like his Guinness, vodka at orange, or FFS, his going to ask for ale, then complain it tastes bad, lol. I won't explain my FFS. Okay. I think we'll just say thank you for that, Seeley, and that's what happens when you go to Guinness. So Guinness and orange and vodka. Yeah, it's a problem, Seeley. It is a problem. Used to own a pub. Tough. That's a tough gig, Seeley. That is a tough gig. Heart goes out to you. My parents used to own a hotel, and tough hospitality, tough industry, especially at the moment. Let's spare a moment to the pub owners and the hospitality sector, because that has been hit badly. I count my blessings every day that I've got a job that I can still earn money throughout all this terrible thing. And anyone who's got a restaurant or a pub or stuff like that. Anyway, going slightly off the point there. Bring it back. Let's bring it back. Here we go. Is local anesthetic more recommended than general? And if so, what are the benefits? Sophia, I've got a feeling, I've got to scroll back. Oh no, it was breast implant. I was going to say it was tummy tuck. It was breast implants. I wouldn't say more recommended. I think it is good. I think local anesthetic. It's local anesthetic with sedation, so it's not like just local anesthetic. It's local anesthetic with sedation. It is good, and the main reason it's good is because the recovery is quicker. Having said that, the general anesthetic is not. It's just you feel a bit more rough after a general anesthetic, and the recovery is a bit slower. But you can sometimes feel pushing and pulling and, getting a bit knocked out a bit with a local sedation. So definitely is something we can talk about. And the other thing I would say to you, Sophia, is that everywhere that I work, we can do both local sedation and general. So first thing is say you don't have to make a firm decision. You can say, look, I'm not sure. And the other thing to say is if you think you might be okay with local sedation, we can go with local sedation. And if it's a bit uncomfortable for you, if it's not really enjoying it much, we can always convert to GA. That's not a problem because you'll be set up for a GA anyway. But yeah, it is good local sedation. CD says you were saying about not recognizing people. Oh, I see. Yeah, I get it. Yeah. Well, Celie, you don't want to know how I recognize people. I see a picture of, and then I think I know who that is, but actually, yeah. Anyway, Sophia, can you feel anything during surgery if under local? No, you can feel a bit of pushing and pulling when the local's going in. So you can, but you are sedated at that point. And the most common thing that anyone says, like for instance, this morning when I did one this morning, and the most common comment is you say to people, "How was it?" and they say, "How was what?" I don't even know it happened. Which sometimes if you want to know what's happening, you get a bit upset. You're like, I want to know what's happening. But yeah, it's you can feel a bit sometimes when the local's going in, but you normally don't really remember anything, and you're pretty heavily sedated. You're certainly not chatting or anything like that. CD recognizes people by their drinks. Got it. What we got here? I got a question here. Can you see? Is it me or is this the question not come up fully? Do you know what we should do? We should put Ask JJ in front of all these to try and encourage the Ask JJ hashtag. Can you see the scar under your breast or is it hidden? BBA. So, yes and yes. There you go. Succinct answer. Move on. Yeah. So, I mean, the whole point is we hide it. So it is hidden. So you have to go like that to see it. Yeah. So it is hidden, but if you look for it, you can see it. And certainly in the first few months, because it's quite red and obvious in the first few months, and then it settles. It does take a good few, like 6, maybe 12 months to properly settle. So, but if you look for it, it's there. So we try and hide it so that you can't see it on the front. But if you sort of look underneath, you can see it. So Sophia says, thanks. Sophia, thank you. And I'm looking forward to seeing you on the 21st. Why do polyurethane implants have less chance of capsule contraction compared to silicone? It is because of the roughness of them, basically. So capsular contracture is scar tissue forming around the implant, and it's normal. All implants, every single person out there with an implant in has got a capsule around it. Whether it's a breast implant or a hip or a heart or a, I don't know, prostate. Do you have prostate? I don't know. Anyway, where else do you have implants? Anyway, wherever you got an implant, the body's natural reaction is to wall it off in scar tissue. And because implants are squidgy, what happens over time is the capsule contracts. And again, that's natural. The scar tissue contracts over time. That happens naturally. But because the breast implants are squidgy, it compresses it and makes it feel hard like a cricket ball. And the reason the polyurethane implants have less chance of capsular contracture is the scar tissue grows into the foam. They've got a foam coating. So the scar tissue grows into the foam in a 3-dimensional way. So it's got in all different. So when it contracts in all different directions. Whereas a silicone implant, particularly a smooth silicone implant, so a smooth silicone implant, the scar tissue just forms around it, and it's much more likely to go hard. And then what they did is they tried to make the smooth silicone implants like polyurethane by making them rough. So that's where the textured silicone implants come in, and they've roughened the silicone to make it break up the scar tissue a bit. It doesn't do quite as good a job as the polyurethane does, but it's better than the smooth. So the roughness, that's why, because they break up the scar tissue and they make it less likely to go hard. But you might say, why doesn't everyone use polyurethane? Well, because the couple of reasons, but the main reason, I guess, is the ALCL, which is a type of cancer associated with implants, and we don't really know what causes it. It's extremely rare, but in the cases that have happened, it seems to be related to the roughness of the implant. So the rougher the implant, the more risk of ALCL. The smooth ones, you don't really get it. So the smooth ones are more likely to go hard, less likely to get ALCL. Rough ones, less likely to go hard, more likely to get ALCL. So it's a balance. So Blue Trolley Dolly, can I ask if you have any experience with skin aid? You can, Blue Trolley Dolly. And the answer with that is no. Negative. Nada. No. Nicht. Niente. Zero. Zilch. No experience with skin aid. No. What is it? It's that drink with the collagen in it or something, isn't it? No, I can't. No comment. No comment, Blue Trolley Dolly. Sorry. You know what? I was talking to someone about this the other day, and you just got to play to your strengths, Blue Trolley Dolly. And I do surgery, and I don't really do non-surgical. So I don't do Botox or fillers or skin aid or goodness knows what. These non-surgical people, God, they're the world's their oyster. They do loads of stuff, don't they? And I just think, there are people out there who that's their thing. And I like let them specialize in that, and that be their thing. I specialize in the thing that I specialize in. I don't dabble. A lot of people do a bit of this and a bit of that and a bit of the other, but I'm like, nah. I just do surgery. So sorry, Blue Trolley Dolly. I can neither confirm nor deny the efficacy of skin aid. Deny the right word. Yes, very expensive, but I'm just not sure if it's worth it. They offer a pre and post surgery package. Well, I've got to be honest with you, Blue Trolley Dolly. My view on all this non-surgical stuff, it's a huge industry, no question about it. You can't knock it. It's a huge industry, so there must be something to it. But the problem is the less like negatives in a way, negative sort of complications and stuff, the less of a result. So there's a huge market for non-surgical stuff because people don't want people putting knives and sticking stuff in them, which is fine. And we don't want to put knives in and stick stuff in if we don't have to. If we can get the same results with some kind of drink, if I could get I'd be all over it. I'd be selling the drink till the cows come home, forget doing the surgery. But at the end of the day, often the less downsides, the less upsides. That's sort of how the world works, I guess, really. So yeah, you got to be. So as I say, I don't know. I don't want to cast aspersions on skin aid. It might be great. I don't know. Just look at people who do it and look at results, and I don't know if it's worth it or not. Because that's the other thing. It's so expensive, a lot of this stuff, isn't it? Your work is amazing, by the way. Blue Trolley Dolly says my work is amazing. Thank you, Blue Trolley Dolly. Very kind of you to